Perioperative investigation in cardiothoracic surgery. Most important investigation is full blood count, as evaluating the hemoglobin will show us the anemia, why there is anemia, types of anemia can be evaluated, and it will help in anticoagulation and type of valve surgery. WBC count, neutrophil evaluation, neutropenia, and it is helpful in evaluating the cases of prostatic valve endocarditis as well. Platelet will show the thrombocytosis or thrombocytopenia, and aspirin and clopidogrel, if the patient is on aspirin and clopidogrel, and effective platelet function can be evaluated. Urea and electrolyte. Sodium evaluation is important in the cases of paraneoplastic syndrome and in cancer of lung. And if the patient is confused, obviously it will help to evaluate the cause of confusion. Potassium is important in evaluation of arrhythmias, and if the potassium is abnormal, then can lead to arrhythmias. Urea, correction of urea is important, as can give rise to GI bleed. Urea can increase with diuretic use and dehydration. Creatinine is a major risk factor for like post-operative mortality in cardiac surgery. So creatinine gives you estimation of fluid and hydration status of the patient. LFTs and calcium. Alcoholics are at major risk of derangement of liver function test, and they can be deranged in lung cancer as well. Clotting estimation is important, as lupus anticoagulant or can be procoagulant, and they can block the graft. Bleeding can be monitored with heparin therapy and warfarin therapy, and need reversal in some cases. In the cases of von Willebrand's disease, there are more chances of bleeding. Similarly, in hemophilia A and Christmas disease, hemophilia B. So diabetics are at a major risk of morbidity and mortality after cardiac surgery, and they should be controlled properly and need to be monitored. ECG, normal rhythm, there are high chances of having atrial fibrillation, bradycardia, or PR prolongation after valve surgery. Left ventricular hypertrophy could be seen. New bundle branch block signify MI, and ST segment elevation could also show there is a problem with the graft, and is there a need for a pacemaker. And if the patient is having temporary pacemaker, then ECG could be monitored because the pacing output and pacing capture and all these parameters should be monitored. Pulmonary function test, so should be done for the anesthetic review, and we can evaluate pulmonary function test in relation to the epidural use, and if it is not good, patient may need nebulizer, and we can evaluate the risk of thoracotomy by evaluation of pulmonary function test. So the valve patient and the CABG patient, they also need evaluation of pulmonary function test. Similarly, the thoracic surgery and the importance of FEV1 in thoracic surgery. Chest X-ray is important to evaluate the heart size, different risks associated with the cardiomegaly, cardioplegia, and types of cardioplegia that we are using. And if there is a trauma associated, then we can see the extent of hemothorax or pneumothorax or rib fracture, aortic calcification, severe risk and carination in off-pump surgery. Lung cancer should be excluded in the current smoker, rib fracture, sternum fracture in the past, and if there is previous wiring from the previous sternotomy, then we need to evaluate different assess for different technique for opening of the sternum. Angiogram is the most important investigation in cardiopulmonary bypass. As you will know what grafts you will need. The stem of left main stem is important. Size in mitral valve surgery, aortic calcification, amount of aortic regurgitation, LV function, aortic valve calcification, which would signify the risk of CVA in such patients. CT is important in redo surgery. RV and sternum separation, aortic sizes need root or arch, and thoracic surgery, tumors, mediastinal lymph nodes, and metastatic spread. Echo, all murmurs need evaluation. Always check supposedly normal valves. Pulmonary and tricuspid valves rarely commented on with mitral valve patients. PA pressure is a major risk factor, and we need to assess the LV and RV function in order to carry out the cardiac surgery. Weight is important. The evaluation of tamponade, leg wound healing, and breathlessness in patient may need diuretics. So, preoperative weight reduction in elective patient would increase the outcome of surgery, improve the outcome of surgery. Blood pressure, left and right arm for Lima, so and the level that the kidney and brain expect. So evaluation of the renal function is important in that case. Swabs, external wounds and valve infection. So if any infection is suspected, then we need to evaluate the microbiologic. We need to do the swab counts, blood cultures, and wound cultures. So, and if there's incidence of MRSA or MSA infection, then obviously swabs are very important. Carotid scan. So the type of operation, blood pressure on bypass, there's a risk of a stroke, and a combined procedure of the CABG and carotid endarterectomy could be carried out. So the clinical examination is most important thing, and it will give you the best idea of the patient's status and will give you the ongoing evaluation of the patient as well. Thank you.